All right, we're going to go ahead and get started. It's 8:30. We have a big day today, a long day, a long exciting day. Good morning. I'm so excited you're here for day two of the Empowering Change Advancing Maternal Health Together Symposium. If you joined us yesterday, we'll talk a little bit about that. If you didn't, if you missed it, it was recorded. It's okay. I'm excited to see so many of you from yesterday returning today and then some new faces. So again, my name is Megan Ockett. I am the program director at Healthy Birthday. For those of you who may not know, Healthy Birthday is the nonprofit organization behind the evidence-based stillbirth prevention program, Count the Kicks. Our mission is simple but powerful: to prevent stillbirths through education, advocacy, and research. Our organization was founded on the belief that stillbirths and poor birth outcomes can be preventable. We believe every baby deserves the chance to have a healthy birthday, and every family deserves to go home together. Yesterday was an incredible day of learning, connection, and inspiration. And today promises to build on that energy as we continue exploring innovative ways to improve maternal health outcomes and support families before, during, and after pregnancy. The conversations, the energy, and the collective commitment to improving maternal health was incredible yesterday. The words you see on your screen, things like innovation, everyone has a role, access, collaboration, community, the time is now, captures the themes that emerged from yesterday's discussions. They reflect the spirit of this community and the progress we're driving together. We created this symposium because improving birth outcomes is central to our work, and collaboration is at the heart of our goal. The challenges we face in maternal health are complex, touching technology, equity, access, and community trust. But we also know the solutions come from working together, from hospitals to home visitors, to doulas, to researchers and innovators. This event brings all of those perspectives into one space where shared knowledge can spark real change. Over the next couple hours and sessions, you'll hear from leaders who are redefining care models, integrating digital tools, and reaching families who might otherwise be missed. Each conversation brings us one step closer to making every pregnancy safer, and that's why we're here. We extend our heartfelt gratitude to our presenting sponsor, WellPoint, for their incredible support and commitment to advancing maternal health across Iowa. Your partnership makes a profound difference as we work together to ensure healthier futures for mothers and families. We also would like to thank our additional sponsors for your amazing support and commitment to advancing maternal health. So, all the fun stuff right now before we really dive into the conversation. I want to quickly go over a few housekeeping things. First, technology. This is virtual. We have lots of people on the line, which is so exciting and wonderful. But we know sometimes technology can have hiccups. So if we run into any issues today, we appreciate your grace and your patience as we work through any technical difficulties we may have, but knock on wood that we don't have anything. The other thing that I wanted to mention was that this entire day will be recorded. After the event, you will receive an email in about 1 to 2 weeks, so give us some time, with access to the recordings, any of the slides, any of the presenter handouts, everything that we talk about. You will have access to that within 1 to 2 weeks from an email that we will send out. So be on the lookout for that. We do have one scheduled break because I was told to add that. This is virtual, so stand, stretch, grab coffee, grab pop, grab water, grab some food, whatever you need throughout the day. This is on you. This is virtual. We want this to be engaging, but we also understand you might need to stand and stretch, and we will too. We'll be standing as well. We want to make this very interactive. This is a long day, but what we really want to do is encourage you to use the Q&A for questions. You can add them throughout the day. We do have time, hopefully, after each panel for questions. We also want to encourage you to use the chat. The chat would be fantastic for emojis, for comments, feedback, that type of thing. So really start using that. I see a lot of you are using that. I love seeing the emojis that come in. I know it's early in the morning for a lot of you, so I really appreciate that too. Any questions that we don't get to during a session or at the end, we will be pulling all those questions down and asking the specific speaker to answer those, and then we will send that. So don't worry that your question might not get answered. We will make sure it gets answered. I'm so lucky to be joined by some of my incredible colleagues today who will help ensure the day runs smoothly. I have Sarah Hybels on the call. She's assisting with moderating sessions and answering questions as they arise. Kimberly Iceberg is monitoring the chat and helping manage Q&A. Jen Rowry is also moderating sessions and fielding questions. And Nia Thomas will also be joining and is also moderating a session later. As I mentioned, we have amazing speakers lined up for you today. We're so grateful for their time and expertise. Altogether, we have over 40 speakers between the 2 days. That's amazing. We want to acknowledge their work and success. And while we won't be reading full bios today, we do have them available on our website. So please check those out. If you want to reach out to any of the speakers you hear today, their contact information is also on our website for you to have. And we'd love to see your favorite takeaways, pictures, anything that you want to share on social media. Please use the hashtag #HealthyBirthday. And one of the most important questions that I always get is, how do we get our continuing education, right? Like, that's important. This is a lot of great information. So Des Moines University Medicine and Health Sciences is the accredited continuing education provider. Certificates will be available for download within 6 to 8 weeks after this day. The email that you will get will actually come from Des Moines University, not us. They're the ones handling all that. So be on the lookout about 6 weeks from Des Moines University. You'll go back into your account and you'll download the certificate. We would also really appreciate your comments, suggestions, your improvements, your feedback. There is a QR code there you can scan. We'll show it again at the end of the session. There's the link to join it, but that's the evaluation. And after you close the webinar today, you will also be given a screen to take the same evaluation. So if you feel up to it, we would really recommend you do that. And that really helps us to learn and do more next time. I also want to give a huge shout out and thank you to our planning committee that truly made this day possible. They helped select speakers and topics, and it was just amazing to work with so many amazing individuals to bring this day to you. And then these are just a couple slides with all the disclosures from all of our amazing speakers. These are also available on the DMU website, Des Moines University, so you can access those at any time to see any of those disclosures. And I just wanted to reiterate one more time that, again, Des Moines University is the accredited continuing education provider, and you will get an email in about 6 to 8 weeks to access your certificates. So now it is my pleasure to introduce the first session of the day. We're kicking things off with Dr. Jennifer Moore, the founding executive director of the Institute for Medicaid Innovation. Dr. Moore is a nationally recognized leader in maternal and child health and improving outcomes for families across the country. Her work focuses on creating solutions that bridge gaps in care, particularly for underserved populations, and advancing strategies that make healthcare systems more equitable and effective. Today, Dr. Moore will share insights on maternal innovation and alignment, setting the stage for conversations and collaborations will continue throughout the day. Please join me in giving a warm virtual welcome to Dr. Jennifer Moore.
Thank you, Megan. I really appreciate it. And welcome, everybody, especially those I was noticing from the West Coast. You are up early. I am joining you from Washington, D.C., but also I'm originally from Michigan. And I saw some Michigan people in the chat. So if you're a Michigan fan, go blue. And so excited to be here today with everyone. If we could go to the next slide. Oh, go green. I just saw that pop up. Yeah, my sister went to Michigan State. So it's a good in-state rivalry to continue. So I'm here to talk about advancing maternal health through innovation and alignment. And I would love to have your questions coming in through the chat. I would love if we had time at the end to have Q&A and a discussion. I really feel like presentations, the best part is always the dialogue and conversation that you have with one another. So please think of this as an opportunity to connect and ask questions or even share your own experiences so that you're connecting with other people in this environment so they can hear about what you're doing in this space. My goal is to touch on a lot of different topics in the area of maternal health and provide you with a really cool tool and resource that you can access at any point to help you navigate within your state. So next slide, please. So a little bit about the Institute for Medicaid Innovation before I dive into the content. So we are located here in Washington, D.C. We're a national nonprofit, nonpartisan policy research and community power building organization. We really center the voice of individuals, families, and communities in all the work that we lead. But also what's really important to us is that we invite all Medicaid stakeholders to the table, and that includes federal government, state Medicaid agencies, Medicaid health plans, provider groups, community-based organizations, advocacy groups, clinicians. Everyone is at the table at all of our work that we lead. Next slide. We have 4 core strategies over our current 5-year stretch of strategic priorities, which you can see here. Next slide. And what we do is we convene experts, we share and empower, we ask what matters, and we answer with actionable insights. And we do that through a variety of mechanisms, which should be highlighted in the next slide. So the circles around the outside represent the topical areas where we do deep dives. And then the inner blue circle represents the types of deliverables that we produce. So everything from convening meetings and national learning collaboratives with state-based teams to quantitative and qualitative data analyses that we publish in peer-reviewed journals. So we do a full range, but really focus on Medicaid in those core areas around, from women and gender health, with a very, very specific area in maternal health, child health, disparities, equity, and behavioral health. Next slide. And I just have to disclose, I am a former Medicaid enrollee, both as a child and as an adult. So while I love numbers, because I'm a researcher at heart, it's not the statistics that make Medicaid real, it's when you love one of the numbers. And this really resonates with me because I'm more than a statistic. I'm a person, and I know that each of you also feel the same. And this is our motto here at IMI. And just to remind us that even as I go through the data and the numbers, through this presentation, to always remember that there are people, there are families and communities that are behind those numbers. Next slide. So here's one of those number slides. So we know that approximately 41% of all births in the US are covered by Medicaid nationally. And Medicaid finances more than half of these births in rural areas, individuals under age 19, and Black, Indigenous, and people of color. Next slide. We also know that 80.9 million people use Medicaid for their insurance coverage, and it costs about $824 billion, with the latest numbers being in 2022. Medicaid, if you're not familiar, is a joint program between state and federal government. 71.3% is funded through the federal government, 28.7% through the state. And there are complicated calculations that determine match rates and things like that. But for the most part, it's a partnership between the federal and state government. And also really important to note is that states are required to cover pregnant individuals up to a certain income level. Next slide. So what's also really important is that although approximately 50% of all births are covered by Medicaid, there's a lot of variation across the United States. So the states in the dark blue represent states that have really high percentages of individuals who are covered by Medicaid. And those that are in the light blue are on the lower range, with Utah being the lowest at 18% and Louisiana being the highest at 64%. Because our hosts are in Iowa. We pulled the Iowa data for this slide, and 38% of individuals in the state of Iowa for pregnancy are covered by Medicaid. Next slide. So we want to give you a little deeper glimpse into maternal health and Medicaid and continue this theme of variation from state to state. Next slide. So one of the things that we do at the university, I was thinking about your continuing education credits for a second there. We lead a annual Medicaid MCO survey, so managed care organization survey annually through the Robert Wood Johnson Foundation grant. And we've been doing this for 9 years. We have about 89% of all Medicaid health plans who respond to this survey every year. And it gives us a snapshot of challenges that they're experiencing, best practices, and opportunities where states can really lean into the various topical areas to advance access and coverage in Medicaid. Next slide. So it has great representation and distribution that reflects the national Medicaid MCO space. We cover 37 of the 42 states that have Medicaid managed care, and it's a very important partnership with our Medicaid health plan stakeholders. They serve on our National Advisory Committee and continue to provide insight and guidance on the survey. Next slide. So it covers a wide range of topics. It is a hefty survey. There is over 1,000 questions on this survey. And believe it or not, the health plans every year ask us to add more questions in specific areas. So it's this beast of a survey, and they eagerly participate. And you'll see the topical areas that are here listed. And the ones that I'm going to really focus in on are the maternal and perinatal health areas. But please know that we have fact sheets, really easy to utilize and pull from our website on all of these topics. It's not text heavy. It's very focused on graphics and data with a little bit of explanation. So it makes it really easy if you ever wanted to copy and paste and pull into a presentation that you're giving and you want to show what's happening in the industry. It's a really wonderful tool. So next slide. So one of the questions that we have on this annual Medicaid health plan survey is taking a look at the contracted providers for maternal and perinatal health services. And you can see here that this is a deep dive into the midwifery profession. And this was really important for us to include on our survey to see the trends over time. We wanted to know, as states really were starting to dig into efforts to address maternal mortality and morbidity, how they were seeing midwives as a part of that solution. Also doulas, but I'll get to that in a little bit. So this slide just represents across the United States, for those who are enrolled in Medicaid, from the perspective of Medicaid health plans, these are the contracted providers that they are engaging with contracts with. And you can see that certified nurse midwives amongst the different types of midwifery types is the highest, but we're seeing trends where this is growing in all of the areas listed here. Next slide. And so we also look at contracted settings. So FQHCs, freestanding family planning providers, freestanding birth centers, telehealth platforms. And just to orient you to this graphic, we stratified the data analysis by health plan size. So small health plans would be health plans with less than 500,000 covered lives in one particular community or state. Medium health plans are greater than 500,000 covered lives, but less than 1 million. And they tend to be statewide or maybe in a small region with multi-states. And then large health plans represent greater than 1 million covered lives, and they represent multiple states. And then that last column is all health plans. And you can see that variation between the different size health plans in comparison to all health plans. So let's just grab one as an example. Freestanding birth centers. For small health plans, they're contracting with freestanding birth centers, about 50% of them. 62% of medium health plans are contracting with freestanding birth centers. And then 83% of large health plans are contracting with freestanding birth centers. And you may wonder, like, why is there a higher percentage? Well, large health plans are in more states. Some states may not have freestanding birth centers, so they have a better opportunity to be able to respond in the affirmative that they do contract with freestanding birth centers. Next slide. Benefits for maternal and perinatal health services that Medicaid health plans are providing. At 94% support from a community health worker. Also at 94% support from a social worker and or nurse care manager. Also high on the list is nutritional counseling and breastfeeding or chest feeding education and childbirth education and lactation consulting. You'll also see here, and this number keeps on raising up higher each year, is support from a doula at 83%. And we see that number growing over time each year that we deploy this survey. Next slide. Some of the most common ways to identify pregnant members, because as you know, sometimes it can be really challenging to identify and capture that pregnancy early on to really wrap them around all of those services and supports to ensure a healthy birth, pregnancy, postpartum period. And so this slide just represents some of those ways in which health plans are utilizing strategies to identify pregnant individuals as soon as possible to make sure that they are getting access to those services. That's really important. And as you see in that square there, that the real goal is to get them in on the first trimester and really getting them in for that first visit and finding out their needs and making sure that they get those services. Next slide. And what you'll see here on this slide is that when we surveyed the health plans, we asked them, what are some of the things that would really be helpful to increase meeting the needs of the Medicaid enrollee who is pregnant. And one of the things that was fairly consistent is increasing Medicaid reimbursement rates. And I laugh because I know that in this community, we all would agree, and it seems like the very obvious thing, but sometimes collecting that data and showing quantitatively that this is something that everybody is really saying and needs to be front and center and needs to be addressed in order to increase that access and addressing the needs of pregnant people can be helpful in advancing policy work. So this is an important slide to highlight what we already know, but it's captured quantitatively. Next slide. And so this shows, again, just variation of benefits, this time by year. So this is looking at trend analyses, everything from nutritional counseling to parenting classes. And you'll see almost for every single one of these covered benefits, you're seeing health plans increasing what is covered. So taking support from doula straight in the center there. When we surveyed health plans in 2021, only 38% said that they were covering benefits of a doula for their pregnant members, comparison to 2025, where they now say 83%. So we're seeing this upward trend, and I really think that this is related to a dedicated national and state level focus on addressing maternal mortality and morbidity. Next slide. So we always ask the health plans to tell us what are some of the opportunities where state Medicaid agencies can lean in more to really help in particular areas. For this specifically, it's in pregnancy. And what I want to articulate on this slide is that in essence, what this becomes is a roadmap for policy opportunities. So as you think about what you're leading in your state, things that you want to enhance in your state, here are opportunities that state Medicaid agencies could leverage, could take the opportunity to enhance to support that benefit for individuals who are enrolled in Medicaid. And consistently across every category of data that we collect, data sharing is the biggest area that continues to be a challenge where if resources were invested in would really help for that health plan to community-based organization interaction, the provider, the community organizations that are around that. So just an area that is important to note. Next slide. area that I want to transition out of. So I always like to start with some data. But now comes that tool that I had mentioned at the beginning. This is a tool that we developed, I want to say 6 years ago now, that we continue to update. It's funded through the Commonwealth Fund. And what we do is we essentially do a deep dive into every state's perinatal health policies, and we map it. So every topic you could possibly think of, we pull the regulations, we pull the law, we keep track of changes and updates to those, and we put it into a platform that you can easily access and find out not only from your own state, but you can compare to the states surrounding you on every topic possible. Next slide. So again, it's an interactive map. It's housed at the Commonwealth Fund's website. But if you ever see something in there and you're like, oh, I was in my state's site and I noticed that you had the regulation for doula coverage, just wanted to give you a heads up that we're working in our state to update that, to change the reimbursement rate. Feel free to reach out to us. We take information from people who send it to us, but we also track and do deep dives every quarter to make sure that we're keeping this up to date. But it's available for every state. And again, you can get information about every topic and do deeper dives. And then pull the exact regulatory language. We have that as a link. And then you can compare to other states. Next slide. And as an example, Iowa, just the quick snippet. So if we're looking at family planning and related services, this is just a snippet specific for Iowa. But then there's an area where you can click on and you can get even more detailed information. Next slide. And that's the example. So we have tables here in Excel that you can download, which provide even more details in addition to links to the sources so that you can access them directly. And again, it is available for every single state. And this is a great tool and resource for you to use within your state. But then also one of the most common things that we hear is that when you're working in your state, a state representative or a governor's office or Medicaid agency will say, well, what is the state next to us doing? And you can say, I happen to have that information also. And you can pull that in and provide that resource for them. Believe it or not, this is the only place where you can get this comprehensive information. So we're really happy to be able to share this with you. It's free. And like I said, we're always keeping it up to date, but feel free to send us any information that you may have that you think might be helpful. Next slide. Here are some of the topics that are covered. Currently, we're always expanding. We're actually going through a transition right now where we're going to be adding 7 more categories to this policy tracker. If you have suggestions or areas that you think are missing, let us know. We want that feedback all the time. Thank you. No, let's see, next slide. This provides a little bit more information in here, but I want to go through this fairly quickly because I do want to make sure that we have time for Q&A. You will get all of these slides. So if you want to go a little bit deeper related to doulas and perinatal community health workers, specific to data and quality, these are the type of things that you'll find in that tracker and in the Excel spreadsheet where you go deeper for every single state. Next slide. And this is another example where you can see the map, so that you can see the comparison, so we can show you graphically. And this is something that you can easily plug and play into slides or into fact sheets that you're creating as you're working in your states or in your community. Next slide. Just another slide. There we go. There's information on midwifery-led models of care, looking at workforce. Again, not going to go into depth. You're going to have this information. Next slide. and it does the comparison across the United States. Wouldn't it be nice if we saw that for doulas also? Like everything was in color, like doula coverage was provided for everybody enrolled in Medicaid. I think we're getting there. You see the numbers increasing. Before we hop to Q&A, just want to say that maternal health, perinatal health is our biggest portfolio of work. Like this is our love and passion at IMI. And so any topic you could possibly want, we have tools, we have resources, we have checklists, we have learning collaboratives, we have learning series, we have everything you could possibly need and want specific to Medicaid. So feel free to browse the website, reach out to us with your needs. We're always happy to say, oh, we've got that resource, or we don't have that yet. That's a great idea. We're going to work to see if we can get some grant funding so we can provide that for you. So feel free to check that out, and I'll hand it to Megan to see if we want to do Q&A.
Yeah, that was wonderful. And here's her contact information too. Downloading the resources. That tool is amazing. That's awesome. So yeah, we actually do have time for a Q&A. So I would love to open it up and see Kimberly, our communications director, if there were any questions in the chat or the Q&A that we could have Dr. Moore answer for the next 5-10 minutes.
Yeah. Dr. Moore, what areas within maternal health is IMI most focused on right now, and where do you see opportunities for collaboration with community-based programs?
Yeah, so community-based organizations are always part of all of our projects. So we don't see it as an opportunity, we see it as a mandate. And we feel like that's really critical to all the work that we do. So in that space of maternal health, I would say our biggest areas, we have a national coalition that we're leading right now, focused on 4 buckets: maternal mental health, doulas and community health workers, midwifery-led models of care, and prenatal to 3. And we've assembled local, state, and national groups together so that during this time that we live in right now, we don't have setbacks in maternal health, and that we're all rowing in the same direction. We're all working together to advance maternal and perinatal health. It's a bipartisan topic, so we can all continue to advance this work and move it forward. But even deeper dives, we have our doula learning collaborative with state-based teams that include state Medicaid agencies, Medicaid health plans, provider groups, doulas, community-based organizations, and people with lived and living experience. We have a midwifery learning collaborative, which also has the same types of state-based teams, with each of those representatives present fully and committed. We have a lot of work in the maternal mental health space. We work with Joy Burkhart a lot, which everybody should know. If you don't, you need to know her. And FQHCs, that's an area that we're starting to dig into even more. We're going to be launching a project very soon specific to FQHCs and leveraging that infrastructure in a way that allows better access, utilization, and coverage for midwives and doulas, and other resources that are needed in the community. But yeah, we cover so much in this area. It's hard to summarize it, but let us know if you have any questions about that.
I would just add really quick, Dr. Moore, are you still taking, like, if anybody wants to join any of those 4 categories of community groups and things, is that an option for people listening?
Yeah, absolutely. So we have cohorts for like our learning collaboratives. Like our doula learning collaborative is in year 2 right now. It's in 3-year segments. And now is the time to let us know if that is of interest to you so that we can plug you into the next cohort. Same thing for the midwifery learning collaborative. We are in the early stages of starting to identify the next cohort. So this is the perfect time to really start connecting it in that way, in that capacity. So if you're not signed up for our newsletter, we send it out every other month about. That's a great place to always be aware of all these opportunities that emerge and come up, because we're very transparent, we're very open, we're very we want everybody to know about the opportunities. And so that's our way of communicating, or LinkedIn. I think our team does a great job of
Gotcha.
letting folks know on LinkedIn also, if that's your preferred communication tool.
Awesome. Perfect. Kimberly, we have time for a couple
We
more, I
had
think.
a couple of questions about other types of data and whether or not you have that. So, one person is wondering if you have any data on hormone therapy. And we also had someone ask if you have information on Medicaid reimbursement state by state for IBCLCs.
Great questions. And I want to go back to my last answer and just clarify one point that it's all of those opportunities are free. And in fact, we pay participants. So for doulas and community health workers, we know that this is a huge lift and to participate in projects like that. So we do provide honorariums and travel stipends and site visits. I don't know what to call it. It's not, let's call it an honorarium for lack of a better term, so that the organizations that are participating that are community-based receive resources. So we always build that into our grants when we work with funders. That's really important to us. We won't accept a grant unless they also are aligned with our value that people in the community should be paid to be able to participate in these projects. So I just wanted to emphasize that, first of all. If someone was thinking, oh my God, how do I do this? And, the cost, I want to rest assure everybody. So related to hormone therapy, yes. If you go to the website for the health plan survey, we do collect data on hormone therapy. If you look at the 2024 fact sheet, it's under the sexual and reproductive health fact sheet. We also have 2 resources that we released this year that provide even more in-depth contextual information and support to Medicaid health plans and state Medicaid agencies who are thinking about what their hormone therapy resources look like. And then related to lactation consultants, we do have data on that. I failed to put that in the slides, but that is in the fact sheet around maternal and perinatal health. And what I presented to you was 2025 fact sheets. They are going to be released in November. So you'll go to our website and you're like, wait a second, she reported 2025. We haven't officially released it yet. So you'll see the 24 and before. 2025 will be up there very soon.
Great.
Has IMI looked into anemia and the impact with African American maternal and infant outcomes?
Yeah, so IMI was selected by CMS to participate in a model that they created called TEMA. I don't know if folks are familiar with it. It's the Transforming Maternal Health model. We were selected to be the lead for technical assistance. There was also the behavioral health and also what they call cell gene therapy. And in that, it had anemia as part of this. Unfortunately, DOGE cut the contracts for that work. And I want to say in April or May, it just all kind of stopped. The states are still receiving funds under that model, but all of the technical assistance work that was planned to support states in advancing that work was cut. So unfortunately, we got that stop work order and we had to stop.
Thank you so much, Dr. Moore. There's so many more questions in the chat and Q&A, which I'm so grateful for and appreciate. And I think, Dr. Moore, if you don't mind staying on for a little bit longer and answering some of those in the chat and Q&A, and then also will be sure to answer people's questions if she doesn't get to any. This was an amazing just kind of opening to our conversation today. Your perspective and the tools that you have just really reminds us about that maternal and infant health is truly a team effort, and we need to have the data, but we also need to know there's stories behind the data. I think that's really, really important. And I know I learned a lot of new things just in the last 20, 30 minutes. So I'm so grateful and thankful for your time today. Feel free to stay on and enjoy the rest of the symposium and answer any of those questions. And Again, everybody, just a couple quick reminders is that you're automatically muted and your video is off. So you do have to utilize the Q&A or the chat. And then also that we will have all the slides available, links in the chat, and we'll send all of that out too. So thank you again, Dr. Moore. And as we move into our next session, we're going to continue the focus on partnerships. She talked a lot about doulas, and I love the fact that these cohorts are available and that they're offering those honorariums and the focus on partnerships and community building. So I'm really thrilled to introduce and bring to the stage, if you will, Jen Rowry and Brittany Haskins, who will be leading the role of partners in advancing maternal and infant health. Jen and Brittany will share practical strategies and real-world examples of how organizations, healthcare providers, and community partners can work together to support families before, during, and after pregnancy. This is a session, again, where your questions and thoughts are welcome. So don't hesitate to use that Q&A. Your engagement really does help make this virtual space more interactive and energizing. So again, please join me in giving a warm virtual welcome to Jen Rowry and Brittany Haskins and our amazing presenters.
Thanks, Megan. Good morning, everyone, and welcome to our first session of the day, the role of partners in advancing maternal and infant health. I am Jen Rowry, the Director of Advocacy and Engagement here at Healthy Birthday, Inc., the nonprofit creator of the stillbirth prevention program, Count the Kicks. And I am joined by Ms. Brittany Haskins, which I'm honored to have her in the room. Brittany, can you introduce yourself?
Thanks, Jen. My name is Brittany. I'm the Childbirth and Postpartum Education Coordinator at Unity Point Health Des Moines. I'm also the chair of Iowa's Postpartum Support International chapter. I love seeing so many national participants on the call today. So if you are not yet connected with your state's PSI chapter, there's a little piece of homework for you. I'm also in the middle of a fellowship project to create and secure funding for a perinatal psychiatric access program here in Iowa.
Awesome, Brittany. We're so glad you're here to kick things off with us. This session specifically will explore the incredible ways that partners, fathers, doulas, and advocates are stepping up to make a difference in maternal and infant health outcomes. And we heard that invitation to the community by Dr. Moore, not just by supporting the birthing person, but by driving community change, education, and advocacy.
So today you'll hear from leaders who bring diverse perspectives from community organizing to family support and legislative advocacy, each showing how partnership plays a critical role in improving outcomes for moms and babies.
We'll invite each of the speakers to share briefly, maybe 2 or 3 minutes, about their work and the impact, and then we'll open it up for discussion and a few questions before wrapping up. Let's get started. I'm so excited. Brad, would you start us off?
No problem. Good morning, everyone. I'm Brad Edwards. I'm the Director of Community Engagement and Program Strategy at Dear Fathers. Dear Fathers is a national storytelling platform, and we're focused on the fatherhood, mental health, and family well-being. So we tell the stories of Black fathers from all angles. And within our platform, we have the program Dads to Doulas. Dads to Doulas was really based off of my personal journey and story. I lost twins in 2017. And we know a lot of what the healthcare system does when it comes to loss for Black babies and Black women. But I can't say that the system did anything incorrect. I can say how unprepared I was, how much I didn't know going into that process, and how much I could have been better in that. So I reached out to a friend, good friend of mine. She was a doula, and she was talking about all these great things as it relates to Black maternal and infant health. And I asked her, like, hey, can you help me be better prepared? Can you help me create what we call my playbook at the time? So that when I go into the labor and delivery room, I know what that language is. I know how to advocate for her. I know what to look for. We created that. She helped me with that. With my daughter and my son, there were no issues. And that was in 2020 and 2021. I reached out to her last year and we launched Dads to Doulas. I was like, hey, can you create something that can help the Black men in our Dear Fathers community the same way that you helped me? And she wrote a curriculum for this. We launched October 1st of 2024. And it's not really about training men to be doulas in the traditional sense. It's about planting the seeds of advocacy in men, equipping them with the support, equipping them to support mothers and children through birth and beyond. So It's been awesome, man. To date, we've had over 450 men across 42 states, including Germany and the UK and Canada. They have participated in this. At the end of this current cohort, we'll be over the 500 person mark, and that's phenomenal. So really, what we're about with Dash to Do is just creating advocacy, helping men understand what their voice and what their role truly is, so that they can lean into that.
Wow, Brad, that's really inspirational and a very important and exciting work. Thank you so much for sharing. I can't wait to hear what questions come in the Q&A for you. Gabby, we would love for you to introduce yourself and your work.
Good morning, everybody. So I'm Gabby Albert. I'm the executive director for For Cure for Moms. And at For Cure for Moms, we are about educate, advocate, and legislate. Those are our three pillars in which we make sure that we're bringing advocacy to maternal health. Specifically, many of you may have heard the story of Johnson, who was the wife of Charles Johnson, our founder and board president. 2016, so next year will be 10 years. He lost his wife after 10 hours of her bleeding out in the postpartum after a C-section. Since then, he has used his voice to bring awareness to the maternal mortality crisis here in the United States, and specifically to the fact that Black women are 3 to 4 more times more likely to die than that of Caucasian women. And our vision is to be a voice for the voiceless and put an end to the maternal mortality crisis. And we do that, next slide, through 3 ways, which is educate, and that is bringing training and empowering change through the community. So our biggest event that we do on an annual basis next year will be our 4th annual block party. We had our 3rd one this past April during Black Maternal Health Week. Is we are bringing education about the maternal crisis, because so many people, very similar to Brad, we believe that here in the United States that healthcare will be all right, that we can go into the hospital and we'll be okay. And the fact is that's not the case. The U.S. has the highest maternal mortality rate in the industrialized world. 84% of those deaths are preventable. So we make sure through what we call infotainment is to bring this crisis to the community. Here in Atlanta, this block party last year was over 1,200 people. It's a day of what we consider birthing joy, in which we celebrate with our community-based organizations. So folks like yourself, folks like BMMA, Morehouse School of Medicine, Piedmont Healthcare, you name it, we bring the Hawks in. And we really celebrate joy and get the community linked to the resources that allow them to have a happy and healthy birth. We also provide maternal health trainings for all stakeholders, from med students to nurses, anybody. And in the future, we're hoping to create more of community toolkits to bring around as well. But with our educate and going to speaking engagements like this across the country, we've reached over millions of people over the past 10 years. Advocate. For us, we believe that advocate we always like to say that it takes a village to raise a child. We actually believe it takes that same village to get that child here, to make sure that a mother is happy, healthy, and strong. And we need everybody. We need fathers, we need moms, we need aunts, we need uncles. We want to take away self-advocacy and bring it back to the community. Let's bring more people back to the hospital, take the dads out the waiting rooms. So very similar to Dads at Doulas, we just launched For Cure for Dads, which is an online curriculum, web-based training. We do it with the sports in the locker room theme. So we bring that into the community locker rooms, and we bring dads in to teach them everything that they need to know. We have a maternal mortality response team, which is to help people, unfortunately, in the situation of Charles, Brad, anybody who has a severe outcome from morbidity or has lost their partner. Will provide wraparound services for them after that loss. That's the one program that we hope we get rid of in the next few years, so that this is no longer happening. And then we continue to work with maternal health advocates and calling measurable action. What we like to say is we have a goal by 2030 is 0 preventable deaths. Like I said before, 84% of these deaths are preventable. That is the CEO's dream. We know what to do in the United States, so let's do it. And so we like to say it's good enough for health. It's good enough for the environment. It's good enough for plastics. Why isn't it good enough for our mothers, for us to have a rallying cry of 0 preventable deaths? And lastly, we believe in legislate, and that's taking it outside of just what we're doing on a grassroots basis and bringing it to both the local, state, and the federal level. Specifically at the federal level, we work heavily with the Momnibus and the Dads Matter Act. We've had 2 Charles has testified multiple times in front of Congress, but we also are responsible for two Federal Hill Days called Dad's Got Something Today, one last September 2024 and one in June of 2024, which again is bringing fathers to the forefront of this fight. We literally are in a time and day where men are making decisions on women's bodies. So let's use that in the affirmative and the positive and get them to step up and say that maternal rights is a fundamental human right. It is not a women's right. It's a fundamental human right. There's only two types of people in this world. Either you are a mom or you have a mom. So it's everybody's business. Look forward to talking to everybody today.
Wow. Love it. I love the passion, the power. I love community voice, advocacy, and also that you believe in bringing joy because we know that there is joy in bringing children in the world and we need to do better so that we can get more moms and babies here safely. Thank you so much, Gabby. Lizette, I'd love to hear from you.
Morning, everybody. Welcome, welcome. Thank you and for having us and having me. I'm Lizette Smith, co-founder and executive director of LaShaaun Liz Foundation, based here in San Francisco, California. Our foundation was born from personal loss, the loss and stillbirth of my son, LaShaaun Jarrell. Out of that grief came our mission to build systems of remembrance, healing, and prevention, so no family feels unseen and unsupported after loss. We serve families through our remembrance events like Wings of Remembrance, what we just had this past October, and Wave of Light, which is a national, recognition of pregnancy and infant loss, lost dues on October 15th, and through our Blessing Box program, where we deliver care packages and grief resources to families, and case management and mental health support services for fathers under our Strong and Silent Father initiative. We're also leaning into innovation. Using AI as a bridge, we're developing 3 AI tools that build AI literacy for families, especially for fathers, so that they can easily recognize red flags in pregnancy, support their partners, and strengthen the household through shared understanding. My book that I put out, my first book, which is called Strong and Silent Fathers, is found on Amazon, which expands the mission. It reminds dads that being present is power and healing is leadership. So I advise, that you guys check that out, Strong and Silent Fathers on Amazon. And at the heart of it all, our message is simple. It's healing families, healing systems. When we honor loss, educate with empathy, and innovate with purpose, we advance maternal health together. So that's what we do. We love to be there to support families and let them know that, they have an advocate out there. Fathers have an advocate out there. They don't have to go through grief alone. And we're here to support families going through loss.
Thank you so much for that really, really important work within the community. Although we want to see every mom and baby get here safely, right? We know that if that doesn't happen, there needs to be a community around those families. And we really appreciate what you're doing. Thank you so much, Lizette. Anna, I would love to hear from you.
Thanks. It's so inspiring to be on a panel with all of you. I just want to thank everyone. I know your stories are meaningful and are driving all you're doing. So I feel a little less than because I know we have so much work to do, and I hear your stories and I want to help, which I think that's how I started my companies. I founded Chicago Family Doulas first. We are supporting thousands of families a year in the Chicagoland area. We have a big team of doulas. I'm committed to getting as many doulas in all communities as possible. I've been partnering with Blue Cross and Blue Shield of Illinois through their Special Beginnings program and have had the opportunity to train about 600 doulas. And we have lots. I'm doing endless sponsorships for doulas to get them to get more of them because we need doulas. that came about from another company that I founded called Birth and Baby University, and I'm committed to training doulas through that organization and also helping families have access to high quality education. I partner with lots of hospitals, mostly in the Chicagoland area because that's where we have our most connections. But I absolutely, I'm happy to partner with all organizations donating these online courses and classes so that families can feel empowered and have a voice in birth and postpartum, and that they can help in some capacity to keep themselves safe, choosing positive and supportive providers, knowing what questions to ask and building community. So that is a big piece of what I've been working on is just creating a sense of community in the doula space and also with families and networking with organizations and supporting them, and just doing as much work in the space as possible to improve outcomes for maternal and infant health.
Thank you so much for the work you're doing in Chicago and beyond, and for connecting the dots and health literacy, right? We know that the better there is community and support, but that health literacy is a key in all of our experiences. So thank you for improving health literacy and community and support. We appreciate that work. So thank you to all of you for sharing your incredible work. It certainly is inspirational to hear how each of you are driving change based on your experiences. And we want that community change and the creation of space for partners to play an active role in maternal and infant health. When I work with advocates across the nation, that's one thing that I hear is my husband didn't know how to advocate for me, or my husband didn't have mental health resources after loss. I hear that a lot from those that experienced loss, that they didn't have a place to turn, and how that was something very difficult in the experience of grief, how they were grieving differently based on the support they were getting and the information. And so we know that you are all playing an important role in that health. So, Brittany.
Okay, so now we're going to shift into a conversation with our panelists. We have a few questions that highlight shared themes of advocacy, collaboration, and impact. And panelists, we're hoping to hear your insights on how your work is shaping maternal and infant health. So, Brad, we're going to start with you. You have built a platform that uplifts and engages fathers. How do you see father engagement changing the narrative around maternal and infant health?
Like Gabby said earlier, 84% of these deaths are preventable. So if you're equipping the man with the knowledge, understanding, and the tools to be an advocate to step in, whether that's doing labor and delivery or whether that's in postpartum, where we know suicide and overdose plays a huge part in women dying, or them not coming home and having a headache and not knowing, hey, let's check that blood pressure, let's get back to the hospital. If that man knows to do that, he could prevent a lot of those deaths. I'm gonna put a link here in the chat that takes you to a lot of testimonials from men that have taken our class, and they understand how to step up, and they're doing it, and they're reaching back out to us saying, "Hey, like understanding what to do and how to do it was the difference maker. Now they're empowered." And the beautiful thing about what we're doing and the seeds really planting sprouting, or these guys are going back to their brothers, their cousins, their best friends, and they're telling them about the value of the knowledge that they learned, and these guys are coming in as well. So Kyra said that she predicted last year that 2025 was going to be the year of the father. And I think if you look at Gabby and Mrs. Smith, you're seeing this, right? It's more men getting engaged, it's more conversations amongst men. Like before Dads and Doulas, I had never spoken to another brother about the loss I suffered in 2017. I was carrying that by myself the whole time. But as we started to do the program, it was more men reaching out to me to tell me their story. So we're having these conversations. So I think you're going to see engagement really picking up just because the conversation and the spaces are being created.
Thank you, Brad. Gabby, For Cure for Moms has been a national leader in policy change and advocacy. What have you learned about the power of storytelling when creating systemic change for maternal health?
So Again, you go back to the staggering statistics. They're known. 84% of these deaths are preventable, yet we still live in a country where it just happens. The fact of the matter is we have to change the narrative. And by bringing those real life stories, it really makes an impact. Charles has done such a phenomenal job in helping to bring that story because it brings a face, it brings a situation, it destigmatizes the fact that, oh, somebody's dying just because they're uninformed or they don't have the resources, they don't have insurance. That's quite frankly a lie. We know that access to care is an issue, but we also know that with Black and Brown women, they're simply just not being heard. The CDC has a campaign that says it's called Hear Her. It's because women are being ignored. In Charles's story, just like many, there's a research out now that shows that the average Black woman who is dying is 120,000 income and college educated. That has nothing to do with social determinants of health. That has to do with implicit bias. And so when we go to Capitol Hill, both at both levels, bringing those stories, what we've really seen is I've gone with just women and I've gone with the men. And when women go to talk about their birthing stories and how it doesn't really make, it wasn't favorable, they almost look and say, but did you die? Which is unacceptable. And this is why we do talk about joy, because our metric shouldn't be our women not dying. It should be our women thriving in healthcare. But with that said, when you bring fathers, when you bring grandmothers, you bring grandparents, what a legislator cannot do is look you in the eye and say, but did they die? Because they in fact did. They hear a story and it humanizes them. And that's the why we keep talking about humanizing and really getting maternal health out of the realm of a women's right. It's a fundamental human right. Women should be able to procreate healthily. It's something that we've been doing before the advent of medicine. So these stories and demystifying what a doula is, demystifying what a midwife is. Midwifery is the standard model of care used in 90% of the world. But in the US, the health industrial complex and the fact that health is literally about money these days is why we have mothers dying. If you look back at the history and you tell those stories of why midwifery came about, why there was why it went down and why it was a resurgence, it really has to do with World War, right? When men were at war, women had to come into the medical complex. They had to become nurses. Midwifery was seen as witch care. Midwifery was birthing us for years. How do we bring that back? Specifically, there's a new bill, if the government comes back up, right? Because unfortunately we're in a shutdown, where it's talking about midwifery for military. That's a huge and pivotal bill. Why? Because the military is one of the largest employers. So if we approve midwifery for military, do you know what that means for Medicaid, for private insurance, and the ability to get picked up, which is going to be so important because we're seeing healthcare deserts come up more and more, right? Rural issues and what we're already seeing in this strain, and God forbid what's going to happen on November 1st when you see the strain of social programs going away. If this big, beautiful bill is passed, and what's going to happen to our systems, if hospitals rely on 30% of Medicaid payments and they take that away, what is that going to do? It's going to cripple hospitals. And you know what's the first unit to go? Labor and delivery. So what we have to do is come together as a community and tell these stories and demand, because right now it's just you go in and you have a baby and it's not that it's okay. That's what the average person thinks. And when you look at a lot of our legislators today who are not educated in human rights and social rights, they literally think that everybody who is going to the hospital is looking for a handout. And that's not the case. A mother should have a fundamental human right to give birth. And that's why bringing the stories, telling these stories, and letting people know that our healthcare system is failing us is super important.
Thank you so much, Gabby. Agree with all the things that you're sharing, and we want to come back to that maybe in the Q&A a little bit further. Anna, you've trained and supported countless doulas, as you've mentioned. From your perspective, how do doulas specifically bridge that gap between families and the healthcare system? Because we just heard Gabby talk about the healthcare system and needing to make bridges, a lot of them. So I'd love to hear your insights.
Yeah, absolutely. I'd like to pull in what Brad was saying, like as a partner, not knowing what to expect, what questions to ask, what to be worried about, what to be mindful about. Doulas help partners advocate for their wives and partners. They are the eyes and ears in the room. But even before you get to the birth, you're doulas prep families and help them come up with so many questions for their care providers. We also help families realize they have choices and options. And if their care provider isn't respecting them, isn't listening to them, isn't giving them options and choices, they can switch. So we're really helping families build a community of support around them, making sure that they know what resources are available, what care providers they may have access to, what questions to ask, that they actually have power, that they have to be their own advocates. Unfortunately, that's just what they have to do. But doulas can also be an advocate for families when families are not being listened to. There's a huge difference that we see and we hear about. Families will say, my first birth, I wasn't allowed to get out of bed. I was told that once my water was broke, I only had 8 hours. And then they're with the exact same provider with a doula watching and being in the room. And guess what? That family has a lot more options. They can get up out of bed. They're not put on a timeline because providers and hospitals know that doulas know what is possible and what is not urgent matter and what isn't urgent matter, and that we're paying attention. And families get treated differently when somebody is there watching that knows and that cares about families. And so just our presence of being there, paying attention, helping families be aware, people have better outcomes. And it's unfortunate that that's where we are, but that is where we are.
Thank you so much, Anna. I think everybody in the room believes very much in doulas, and we're going to continue to hear about the impact doulas have. And I love that this year is 2025 is the year of birth and whatnot. I love that, Brad, that you said that. So I think that we can build on that for 2026. But Brittany,
Year of the dads and doulas.
and dads and doulas.
So, Lizette, speaking of dads, your foundation honors your son's memory, which is such an important perspective to have here on this panel. How can we better support families who have experienced loss, both within the healthcare setting and out in the community?
So, support begins first with acknowledgement. Families experiencing loss shouldn't have to leave the hospital feeling invisible. They should leave with resources, community, and hope. Inside the healthcare, we can train providers to speak with compassion, normalize conversations about stillbirth and grief, and connect parents immediately to culturally competent bereavement support, not as an afterthought, but as part of the standard care. In community, we need spaces where fathers can grieve openly and mothers can heal without isolation. That goes from churches to barbershops to local nonprofits. Doulas, case management, and peer support groups all play a role in carrying that care forward. And systematically, we must fund and uplift community-led organizations, the closest ones to the families, to drive prevention and heal together. And then when empathy becomes policy and remembrance becomes practice, we transform loss into legacy.
Thanks for that.
Yeah, Very powerful. So we are like looking for questions in the Q&A and bringing those to attention. And Brittany's working with me because I'm off script because I'm just going to talk to you about things. I think one thing that we want to know is there are a lot of people in the audience from different types of systems, right? Like from community-based programs, from their own individual experiences to healthcare systems. And so, really thinking about that audience, what are some practical ways health systems or community programs, and this is for anyone out there, can engage partners earlier and not just in that crisis moment, but how can we make that community stronger before a crisis even happens, and throughout that pregnancy to even before pre-pregnancy. What are some of the ways that you're seeing in your work or in the communities around you that there's a whole team coming together even in the very beginning to make healthier outcomes? Gabby unmuted.
So, Jen, I think that's where it comes back to really awareness and talking, right? Unfortunately, childbirth and pregnancy has become a very taboo topic. It is a very private topic that people typically only talk about with, their moms, maybe their grandmothers, aunts, best friends. When the reality is, we have to bring this out because the average person, again, it goes back to I have insurance or I'll go to the hospital and I'll be okay, right? I mean, in the United States, we always say, and we hear people, I would never want to go to a hospital in a third world country. Well, the reality is some of them third world countries will treat you better than we get treated right here in the United States. And so it's bringing that awareness first that, you know what, complications can arise. So there's awareness and then it's preparing for the worst so that you can have the best. It's role playing, it's understanding what happens in these situations. It's recognizing that a conversation has to be had about your birthing plan, that you don't leave it 100% up to the doctor. One of the things that we like to say at For Care for Moms and Dads is you are the expert of your body. The doctor is the expert of medicine, and it's the marrying of the two that creates the perfect environment for a happy and healthy birth. And so one of the things that we are specifically doing is we are starting to go to college campuses. We do an HBCU tour with Walmart. It's very small right now, and going to there because the next generation, they have the power to change not only their outcomes, but also from a legislative basis. And if they, I always say these days, we see this young generation have these lavish baby showers. They take all these beautiful photos. They have gender reveal parties. Well, if you would take that money and apply it to a doula, apply it to a midwife. By the way, do you even understand the difference of a doula, a midwife, a doctor, and how you can have all three, right? So it's breaking down, it goes back to the stigmas and having those conversations. But teaching people, hey, yes, you can afford a doula, even if it's not picked up by your insurance, right? $1,500 to $2,500 up to $5,000. That's just not a vacation for a year. That's not, that's saving. If it's putting on your registry that this is what you're saving for, there's a lot of ways that we can do this. We just have to think about it more smartly, and we've got to get everybody talking about it. I'll give a shout out because they're one of our biggest partners. Bobby, the work they're doing right now with Cardi B to get people out there to call Congress. We need people talking about the crisis here in America as if it's crisis. We need our celebrities to stand up and say, yes, child and maternal care is not right. Paid leave for all is not right when you get, when the baby comes home. And so I think it's redefining the conversation and inviting everybody in. It's inviting that village in. It's no longer just a women's conversation. It's everybody. The father plays an important role, and it doesn't matter if you're married or not. Making men understand that from pre-birth, they're just as important, not just afterward. Money cannot bring your child or your partner back. So what are you doing ahead of time? We know that when men show up to prenatal visits, outcomes are 90% better. We need you there. We need you changing a diaper. We need you skin to skin contact. That's not only beneficial to you as a for your health, it's beneficial to the child, it's beneficial to your partner. So it's redefining and creating these safe spaces. Brad mentioned the playbook. We call ours a playbook. We taught a locker room. Lizette mentioned, barber shops and churches. And that's what we're doing with our fork here for dads is we're creating this environment for men to talk about. It shouldn't be a taboo subject when we're talking about maternal health. Everybody should be talking about it, and everybody should be able to play a role, whether you have a child or not.
Absolutely.
Powerful. Yeah.
The amount of emojis going up for you is impressive. You are all welcome to join this conversation, by the way. If you have questions for this amazing panel, please put them in the Q&A. We have Kimberly looking through the chat in the Q&A so that we can make sure that we're getting your questions answered because we have 4 brilliant minds here. So ask away.
Someone asked about integrating postpartum doulas, and I thought after I spoke, I should have mentioned that piece as well. Doulas aren't just the eyes and ears in a birth room. We are in families' homes day and night paying attention to things. In my trainings, and I'm always mentoring doulas about this, like that's a huge honor and responsibility to be in someone's home, paying attention to them and helping them in this process, and we can't miss anything. We are watching how mom is doing and how they're recovering. And if they say something to us, we can't just brush it off. We have to be on high alert and pay attention to, is she healthy? Is she improving? Is she getting better? Is she getting stronger? Or is she staying the same? Staying the same isn't good enough. She needs to be improving daily, getting strength daily, and paying attention to the baby. How are they doing? Are they thriving? Are they eating well? How is the partner participating? Can we integrate them more? So we're really, yeah, somebody mentioned like being a holistic piece of this puzzle where we're making sure that family calls the doctor and goes to the hospital if something isn't right. If baby doesn't seem like they're doing great and thriving, we're telling them you should probably go to the hospital. Let's go together. Let's ask these questions. This is what's normal. Like doulas, both birth doulas and postpartum doulas should be the experts in normal, knowing what normal and healthy look like. And anything outside of that, we should be alerting families and helping them be connected to healthcare. And whether that's mental health, a doctor, their midwife, and then Gabby, thanks for saying that. We're getting there with knowing the difference between midwives and doulas, but midwives are medical providers, doulas are non-medical providers, but we make sure that people are connected to the accurate medical providers, lactation consultants, and pelvic floor physical therapists. So as part of that community piece, I'm seeing all of those people so much more connected and wanting to help families in a very holistic and full way.
Thank you, Anna. Brad, I see you have your hand up. So polite.
Yeah, someone asked in the chat, can parents from other states join? And I just want to be clear, like everything that we do outside of the in-person workshops that we do, everything is virtual based. So like I mentioned earlier, we have had men from 42 different states that have been able to join within this past year. So it's a free class. There's no charge. It's 6 weeks. We meet once a week for 2 hours, and then we have specialized meetings for whatever subject matters. If there's guys that want to learn more about the NICU experience, we could bring in guys that can speak to that and what that looked like for them, as well as you don't have to be an expectant father. Our last cohort, we had a brother as young as 20 years old, and he just wanted to understand because he's been hearing about these things where he had women in his family that experienced complications, so he wanted to understand what he didn't know. And we had a brother that was old as 55 years old, doesn't plan on having any more kids, but because he works with young people within the community and sees himself as a community father, he wanted to learn his education so he can be a vessel for them and he can educate them on the things that he learned in the class. We have people that come in like, hey, I'm planning a family for next year, so I just want to be prepared. So I just want to make sure be clear on you don't have to be an expectant father. We're not, cool if you are, but we just want men to be here to be able to understand why it's important for them to be here.
Feel like you're all going to get a lot of traffic to your website and your book and your programs after this based on what we're seeing in the chat. Kimberly, are there other questions in the Q&A that you want to read out to the panelists?
Yeah, one question for all of you. How can we ensure that partner engagement strategies are equitable and inclusive, especially for those families who may face systemic barriers or cultural differences, and in how partner roles are viewed?
I'll answer that from our perspective. So in Missouri and Indiana, we are doing provider symposiums. So we're looking at this like if we equip these men with these tools and help them understand how they need to go into these rooms, the providers need to understand how to receive them and how to make sure that the engagement is recognized and understood. So outside of just making sure that we're changing that narrative in the community overall, but definitely with Black men, we're making sure that we're reaching to these providers and also with doulas, right? So some doctors are adverse to doulas, so our dads and our doulas need to be embraced and understood that they're all there for the benefit of that mother.
So within For Care for Dads and over the work we do, we definitely do provider trainings, but we make sure that we are addressing that communication. And again, in that family planning and warm up in trimester one, when you are looking for your healthcare providers, is to ask those right questions. Ask specific questions up front about cultural nuances and differences, and don't be afraid to change your doctor. That's one of the biggest things that we see and what happens in when you look at these 84 preventable deaths and traumas that occur is a lot of people in their gut in retrospect recognize that I don't think this is necessarily the right doctor for me or the right healthcare provider, but they felt trapped. And so asking those questions up front that can address, is this provider culturally competent? Is this practice culturally competent? Understanding that when you go to a doctor's practice, you need to not only have a rapport with your doctor, but you also need to get background on the rest of those doctors, because when your day of labor comes, your doctor might not be there. They might not be there because they could be off duty, they could be on vacation, they could be tied up in another surgery. And so do you know who the other providers that you might get care from? Do you have those questions up front? Do you understand the birthing bill of rights? And when you go to a hospital, you have the right to say, you know what? I don't think that this nurse just addressed me properly and I want a different nurse. Do you understand you can go to the chief nurse? So we talk about all of that in our curriculum and making sure that you are aware of the structure and how it works, not just um, the knowledge, and then also the communication. How do you talk to a doctor? How do you recognize? Do you recognize that, and we leverage and we believe in the rising tide theory that, if you focus on the worst, the outcome will be for everybody. So For Care for Dads is for all men, but we did specifically base it on cultural competencies of Black men because we know that not only are there women dying more often, but we also know the perception that if a Black man raises their voice, they might call the cops at the hospital. And so how do we address and have conversations about, do you have a care team ready and with you? And Brad mentioned some of the testimonials we hear all the time that, oh, which my partner, she wants to have her mom, her sister, and me, but I think it should just be us. In a private moment, yes, just the two of you, but do you understand that those other roles, what they can play, that they can be on the lookout to see what another provider is doing? They might have a better bedside demeanor with a provider. They might be able to talk to somebody with the provider. They might know somebody at the hospital who in your network is a medical professional. Do you have them on staff? Do you talk to them? So we talk about all those nuances and specifically cultural competencies. And the provider part too is making sure that we partner with providers with our curriculum, because that is one of the things that they need to be held accountable for as well.
Absolutely. I think the importance is that everybody needs to be educated, right? Like we have to improve everyone's education and their competency in that. So, Kimberly, more questions?
Sure. Could you all share some examples of how you have seen healthcare systems partnering with doulas, midwives, community health workers, home visitors, etc., to provide education and to empower partners beyond that standard, patient packet or childbirth class? What are some examples of ways that you've seen healthcare systems partner with these community supports?
I could speak on that. Most states have something called the PQC, and in Illinois, the PQC is doing a lot of collaboration with doulas. One thing that they're doing is called a respectful care breakfast, and this invites families after they had their birth at a hospital to come to a breakfast to get in front of doctors, nurses, doulas are invited as well, and share about their experience at the hospital. And it's not usually great. And the first time I went to a respectful care breakfast, I was expecting something very different where they would be like, "Oh, thank you so much, everyone." It wasn't like that at all. It was really telling all the staff how they weren't supported, that the mistakes that were made, the lack of communication, the lack of empowerment, and many of the families that had a doula had a positive experience. So it's really great for the hospital staff to hear that their doula made all the difference. And I think that's what they're hearing over and over and over again. So that's one way I'm seeing hospitals partner with us. Like they're inviting doulas into those respectful care breakfasts. They're inviting us into their meetings to talk about policies and to get our input on things. We have a long way to go, but I entered the space 12 years ago, or actually 15 years ago as a solo doula, and then 12 years ago as an agency owner. And it has changed dramatically in a positive way. So even some of these healthcare systems that were very rigid and against doulas, they're opening up their doors, they're recommending doulas. So we're moving in the right direction, but I do see us getting invited to those spaces. I think what Gabby was mentioning, like that they go in and they talk and train medical teams. We do the same, like doulas go in and we're training nurses and midwives on comfort measures, on supporting their patients. Sometimes I'll speak to doctors about how to collaborate with doulas. So we're getting there, and I see us more and more integrated. I think we have a long way to go, but I think in the next decade we'll see a lot more integration.
I could speak to a little bit of that too here in San Francisco. Um, every second Saturday is called Pregnancy Pop-Up Village, where providers, community-based organizations, doulas, they're all coming together. It's about 30 agencies that have roundtables where families can come and get early pregnancy information. They can come and connect with doulas, like Black Infant Health, Sister Wives, Sister Web Doulas. We have a father's lounge where fathers can come and sit and engage and talk, ask questions and get answers. And also, fathers can share stories about their experience. And each table, it's not just passing out resources and information. They actually engage and have full conversations and answer questions. So families can actually, outside of the hospital, be able to speak, to a provider or, a doula services or even human resources that are available to families, to be able to help them, whether it's, having a family that needs somebody to watch their baby while they actually go to the hospital. If they need to get a ride, it's a lot of resources that are placed there at this pop-up village so that the way, hospitals and providers can actually provide their services outside of the hospital to in the community. And this is led in a community at the YMCA, local YMCA, where it's just a, community center where they can come and not feel that, they're under that, kind of umbrella pressure of like being in the hospital. And it's more of a relaxed kind of setting. And also family accountability boards and community advisory boards where community-based organizations are talking with providers to help in, change policy and make sure that, implicit bias is not happening. And how do we actually do role playing so that way they can train their staff better and how to, speak to patients and not be discriminate on that patient when they see them come in and it's just maybe the mom coming into the room and they have a baby and they're looking at how their, image is or just how they're acting. And then they may, not provide or share certain information based on what they're saying, or they're short, right? That you only get about 5 to 7 minutes, information that maybe you're sharing is real quick. They're trying to get you in and out so they can see the next patient. But sitting in these boards and just actually seeing how we can better serve the family and make families feel seen and important, right? Ask the dads questions when they're in the room and not just talk to the mom, right? And make sure that they have a voice and being able to say something or just making them feel comfortable and there, right? I think that's one of the ways that we're trying to improve. And like Anna said, it takes time. But the effort is there and they're trying to move in that right direction. And just being a part of that circle to make sure that that happens is one way that we're seeing that providers and hospitals and community-based organizations and families are coming together at the round table.
Who's convening these groups in your communities? I know Anna said like the PQC in Illinois, but I'm wondering who's leading the convening? Who in your community? And maybe there are people out there thinking I could lead this, right? Or like we don't have that, or maybe we do, and I don't know how to find it. Like who in the community is leading these types of great opportunities to come together?
So for the family, for the pop-up village, it's based through UCSF, and they work with other CBOs to connect to put that together. But it's UCSF, excuse me, based. And the Family Accountability Board is the same. The Community Advisory Board is through the Department of Public Health.
Okay. Many different players, but good to know community-based organizations if you're out there, or PQCs, or health departments and public health workers. I hope your wheels are turning about these types of convenings because it sounds like very powerful change comes from that. So great. Kimberly, more questions in the chat?
Yeah, somebody asked if there are ways that we can reach girls and women and help them learn to advocate for their bodies earlier than pregnancy.
Yeah, so as I mentioned, we are actually looking at working with colleges and universities. Charles and I are both Florida A&M University graduates, so we are actually working with them and their public health school to create the first ever For Cure for Moms chapter. We're hoping that work will actually bring about what that model looks like, how to get more students involved, but letting them know about this issue ahead of time so that they can properly plan, as well as how do we get more men involved as well, because advocacy and health advocacy is not just unique to pregnancy. And so making those parallels that, when you do help a mom in pregnancy, that will help you in the future. I've talked to AARP before briefly about, doing some sort of idea with, if you help them now, they'll help you in the future type thing, because that kind of circle of life, when you think about patient advocacy, that, your mom will help you when you're having a child, and when your mom or your parent gets older, you'll help them in their later stages of life. So I think it's thinking in the non-conventional areas and making sure that we're trying to tack it on, as well as how do you simply just, again, go back to making maternal health more open to all. So at For Care for Moms, we really do try to invest in events that bring out the community so that everybody feels they play a part. Like I specifically, I'm actually uniquely not a mom in the space. I'm everybody's auntie and godmother extraordinaire. And so I take the kids, I give them back. I help at birth, I help at, different at spots, but I'm not a mom, but it doesn't mean that I can't help. In fact, I can be a patient advocate in sometimes in a lot of better ways because that emotional and physical tie is not there as if your mom or your aunt, somebody related to the child. I can be there and talk to the doctors, things like that. And so I think it's really helping everybody to recognize everybody plays a role. And also that we talked about it before is that health literacy and understanding how healthcare works. Do you understand how your insurance works? So making sure that people understand insurance, choice and selection of doctors, what a doctor should be doing in today's day and age. Yes, doctor's visits may only be 15 minutes, but if they don't have an app and they don't have a 24-hour or 48 return policy with questions, you should probably look at another, a different practice. So how do we get young women and men at an earlier stage to recognize that health is important, health is wealth. And so what are the adjacencies to pregnancy? We work with Walmart. Nutrition and health is really one of their biggest things. So at different events, we partnered with the Thrive Tour, which is very similar to what those pregnancy pop-ups are. It's like a 20 state or 20 city tour that Dr. Reverend Q English puts together. We joined them in Hollywood, Florida, and we joined them in Nashville, where we hosted their men's village. But we did it in partnership with Tennessee State University. And we had a health symposium. And so we brought the nursing students in to talk to them so they could see real life advocacy from For Care for Moms, from what Walmart's doing, from what Tennessee State University doing, from what Meharry's doing. So we called it Stronger Together, which kind of goes back to that last question of it really does take everybody across the perinatal health workforce to make a difference. We have to, CBOs and nonprofits have to partner with doulas and midwives and healthcare providers. We not only just OBGYNs, bring pediatricians in the mix. We also have to make sure that general doctors are in the mix, because what we do know in the postpartum spaces, 40 to 50% of women are not going to that first postpartum appointment. So what does that mean? They're likely going to go to their general practitioner, making sure that they are educated, that nurses are educated, and not just labor and delivery nurses. Because when you get through and you search through the data, we also find out that a lot of times, if you're in the ER, an ER nurse is not necessarily trained on labor and delivery. So how do you advise them of what you need? How do you talk to them? How do you give them implicit bias training, bedside practice training for pregnant women? So it takes everybody, but really talking to youth to make sure that it is not taboo. I'm not going to get pregnant and it's gross. You got to get out of that mindset and talk to them in an adult form, and help them to see the parallels of childbirth. And again, I'll repeat myself, but maternal health is a fundamental human right. So it is everybody's business. And that's the message that we believe. And we do think that the more and more people know, then the more and more people will get involved and will start to make a bigger change.
Great comments in the chat as well about that question. Sounds like we could all go on for a while about that. I think we might have time for one more question before we wrap up this panel. Kimberly, do you want to pick the last one?
Yeah, I think you've all shared some amazing ideas and some amazing ways that your organizations are helping to create change. But if you could change one thing about how our systems, providers, or programs are including partners in pregnancy and in loss care, what would it be?
I mean, I know we've said that we're getting integrated into the systems, but just like conversations and connection with every aspect of perinatal health and making sure that everyone's on the same pages about families and listening to families, like just making sure that everyone is integrated into the space and has a voice. I think that's so important, and that's not happening in many places or most places.
I would say simply for me is erase the biases that exist towards Black men and understand that when allowed the opportunity, when included in the conversation, included in the process, these men are going to show up and be completely engaged. We start there. I think a lot of things can be eliminated.
So for me, is that the recognition that we do have a problem, right? The fact of the matter is the healthcare system in the United States is broken, and it's a tired debate that it's not. The fact that universal healthcare is being debated, is being rolled back, that the Affordable Healthcare Act is being taken away when the rest of the world, we see the blueprint that works. If we would just reinvest our money into our healthcare system and take the cost component out of it, it will fuel everything else in our economy and healthy and thriving lives. And so I really do wish that the cost component of healthcare was removed because healthcare should be a fundamental human right. If you're sick, you can get me sick. So it's my business and to worry about it, but it shouldn't have to drain my pockets, and we shouldn't have to worry about doctors' pockets being drained, them not being reimbursed. It should be a very simple system, especially with childbirth. We talk about, in this day and age that we need a nuclear family. Well, the reality is you can't have a nuclear family if the mom and the baby don't survive. So it's time to cut the BS and for us to cross the aisles and to be bipartisan. And I fully do believe that motherhood is that fundamental factor because again, there's only two types of people. You are a mom or you have a mom. And nobody would want their mom to die on the table. So wouldn't want that for anybody else.
Gabby, there are some calls for your presidential run in the chat if you would like to start drafting that. Lizette, no pressure, but do you have some closing words that you'd like to end with?
I would just echo Brad and just say, yeah, acknowledgement and recognizing the fathers. We are a presence and in the room too. We're there to support and lead the household, and to make sure that our partners are, getting the care that they need and making sure that our babies are being born healthy, and that we're getting the right care in the hospitals and, making sure that, the questions that we have just to make sure that the pregnancy experience and our journey throughout each of those trimesters, are being answered. And we're getting the right resources and the right tools to be able to see our families through. In case, there are times that, the mom is not feeling well and, going to her appointment, and we're that voice, right? To be able to speak. Sometimes she can't speak to the experience that she's having at that moment, and we can be able to articulate that and be able to share what we've been seeing out of our eyes. Okay, this is what's going on with my partner that I see as well, and how better to help our partner get through that experience. So just recognizing and acknowledging the father, that we're present and strong in the household as well.
Thank you. And thank you to everyone who asked questions. I know we didn't get to all of them, so panelists, if you're able to stay on and type questions or answers to those in the Q&A box, you're welcome to. Otherwise, I believe everyone put their contact information in the chat, or you can Google them or buy their book. But this is definitely just the start of it. So thank you to our panelists as well for such a thoughtful start to the day.